Good morning, everybody. Thank you for the opportunity for talking to you today. My name's Kathy Finlayson. I work at the Centre for Healthcare Transformation at Queensland University of Technology in Australia. And it's lovely to have the chance to talk about one of the products of the interaction of this working group. So we've heard some great insights from my colleagues in this group on person-centred wound care, and we all know it's something we've been talking about now for a couple of decades. And you know, there have been even systematic reviews. We know that person-centred wound care has been embedded in many of our practice standards, and I just wanted to highlight some of these points from a key systematic review in 2014. That, you know, it considers our biopsychosocial frameworks. It considers patients as informed and empowered partners in care, and of course involved in decisions in care. That we encompass collaborative care, and that in principle, you know, we are supporting access to care for all. As I was saying, these have been embedded in many of our standards of practice in our health systems policies. There have been a number of documents that have been put out to really highlight the importance of person-centred care, not just in general, but in wound care specifically. You can see some of them there in the US, but Patients' Bill of Rights, Wound Patients' Bill of Rights, I should have said, you know, Patient-Centred Outcomes in Wound Care, and then Wounds Australia on this side of the globe, within our standards for wound management, state that care must be delivered using a collaborative approach between the individual, the professional team, the healthcare workers, and of course family and carers. So we all know, though, in practice that it's one thing putting things in guidelines and standards, and it's another thing actually experiencing it and putting it in itself. We know, many of us, that a problem still exists, and even personally, just speaking with friends and colleagues, we're still experiencing a lack of person-centred care, and I can still see it happening with many patients who are living with wounds. So in 2016, as may have been mentioned, you know, this group under Ellie's wonderful guidance presented a symposium at the 2016 World Union of Wound Healing Societies Congress called Why We're Failing in Person-Centred Care, discussing these issues, and that was subsequently published. We realise that it's a multifaceted problem. There's no easy fix, that many of us are not, of course, deliberately ignoring patient rights or deliberately excluding patients from collaborating in care, but many things step in and interfere with our person-centred care. And, you know, things that we all know, the first thing that pops to mind, of course, is resources and time and urgency, but it's also embedded in organisational culture. And sometimes entire health systems cultures. There are many issues at many levels that we really need to address to fully embed person-centred care. Following that 2016 symposium, the group has met regularly and thought about this and thought about what can we do to help? What can we actually do to facilitate person-centred care? And one of the things we thought might be useful is a simple algorithm where people can use in practice to constantly remind themselves and check. We know that just simple reminders and easy to use resources have strong evidence to support that it actually helps us as health professionals to get things into practice. So our aim actually was to develop that clear algorithm to facilitate engagement between healthcare professionals and people with wounds. The idea being that it literally was something that people could look at quickly in 5 seconds as they walked past. It may be stuck up on a board somewhere, it may be in their working notes, just to check key points and reassure ourselves that we're actually involving our patients in their care the way that we would like to, and that their care is focused on their needs and meeting their needs. So the algorithm is aimed for the use of health professionals, all health professionals. Certainly wound care would have to be one of the most multidisciplinary areas that I know of. But also it's also useful, we found, actually to guide education that you might be giving to other healthcare professionals. It's also useful just to guide the principles that might go into resources that we're developing for consumers and for families. We went through a process of going through multiple drafts over multiple meetings, and those drafts the content was contributed to by a range of people on the panel: academic researchers, consumers, very important, and end user stakeholders. And once we actually put the content in, we went through multiple revisions and then sent that out to experts and end users for review. So finally we ended up with an algorithm which consists of a series of prompts just to help us with implementing principles of person-centered wound care. So here is a copy of the algorithm. I'm sure it is freely available from the Leg Club website, and I believe that there will be some printouts there as well, should you be lucky enough to be at the meeting in person. You can see that it's split up into 4 areas, one being, preparation before you're even meeting with a patient with a wound, one concentrating on the first and initial assessment of somebody, one thinking about after that first assessment, follow-up care and what might need to happen, and then ongoing long-term management. So obviously if you're familiar with it, you get used to it, although it may look a little bit wordy at first sight. You know exactly which colour you're going to go to, and you've got a series of dot points there that you can just quickly check and run through and think to yourself, yes, I think I've covered all those points. I think yes or no. And you can see it literally folds through a algorithm approach. Go through this, have we done this, yes or no, move on to the next, yes or no. So yeah, very easy to use, simple. You can just go to the points that you need at the time. So we know that an algorithm is just one tool, it's one resource that we can use in our professional lives. It's certainly, I would hope, help to engage people and help just remind us of all the ingredients that are needed to form that successful therapeutic partnership when we're working together with persons and wounds. The group of us also realised that, of course, people with wounds and their families and carers also need a range of information to use to be able to have that power to make informed themselves. And so there are a whole range here of brochures which cover a series of information on various topics. You can see there general ones just about a wound. What will I expect from my health professionals? Why would I have a wound? What are my rights and expectations during treatment, and who's going to help me? There's spaces for notes, spaces where we can circle, etc. relevant to that particular person's needs. And then we've got a range here on different topics: venous surgery, tonsil surgery, abdominal surgery, because of course there's specific points relevant to them. That's just my references. And I just want to say thank you again, and I hope you're enjoying the symposium.